As we all know, healthcare is the big issue at the moment, so I'm going to take a moment to talk about what the problem with American healthcare is now and suggest some possibilities for how to attack these problems. Typically, the problem with American healthcare is described as something like this. There are 44 million Americans without health insurance. This means that if something goes wrong with their health, they may be forced to forego treatment or forced into bankruptcy by medical bills that they just can't afford to pay. The solution, therefore, is obvious: get universal health insurance implemented. However, this view of the problem actually makes very little sense. For example, I could say, almost no American has refrigerator insurance. So if something goes wrong with their refrigerator, they may be forced to forego using it or forced into bankruptcy by the bill to buy a new one. This is, of course, nonsense. Of course, we all recognize that refrigerators do occasionally break down, and that is an actual annoyance. And they tend to break just as soon as the warranty, which is actually a form of insurance, runs out. So why aren't we up in arms about the lack of refrigerator insurance? Now, the reason should actually be obvious. Refrigerators aren't actually that expensive compared to medical care. If you're willing to shell out $1,000, you have a wide variety of refrigerators to choose from. But if you get diagnosed with cancer and only have $1,000 to spend, you don't really have very many options. So the real problem isn't this lack of insurance. The real problem is that healthcare is so expensive. Now, if healthcare were cheap, we wouldn't even be having this discussion about how we can ensure universal health insurance coverage. So far, we've established that the uninsured are not the problem. The problem is the high cost of healthcare. So let's answer this question. Why is healthcare so expensive? Here there are two sides we can approach from, the demand side and the supply side. Now, I think the best answer comes from the demand side, so that's where I'm going to focus. In short, I think there's an excessive demand for healthcare, and that this drives up the underlying price. To get at this, we have to think about the type of insurance that the grand majority of Americans have. That's called group coverage. Now, under group coverage, every member of a particular group is charged the same premium, regardless of their individual risk factors. In the United States, the group tends to be a group of employees that all work for the same employer. So let's first note that this is very different from other types of insurance. For most, your premium is proportional to your risk. So if you're a high-risk driver, then you have to pay a very high premium for your car insurance. If you have a very high risk of death, you pay a very high premium for life insurance. If you have a high risk for fire or property damage, you would pay a very high premium for fire or property insurance. This is not so for group health insurance. So we shouldn't think of group insurance as insurance in the same sense that car insurance is insurance. Rather, it's far more accurate to think of it as a cost-sharing program. That is, each year the insurance company estimates how much will be spent total for the group. Then this number is divided up evenly between all the members. So, what impact do you think a system like this would have on the behavior of consumers? To get at that, let's think about what happens when an individual consumer decides to spend more on healthcare. Say they decide they need to see the doctor because their neck hurts when they move it a certain way. The cost of the visit to the insurance company is $100, let's say, and there's no copay. That keeps things simple. Now, suppose there are 100 employees at this company. In that case, this visit costs each employee, including the employer going for the visit, about $1. This is far below the actual cost of the visit. So what happens in this system? Well, there's a division between the true cost, that's this $100, and the perceived cost by the consumer, that's this $1. This means that cost-benefit analysis, it gets all messed up. So our individual consumer is willing to go to the doctor as long as they expect some benefit that's worth at least $1. That's what they actually have to pay for the visit. However, the cost of the visit is $100. This creates what I'd call an excessive demand for healthcare. Because people only pay a tiny fraction of the cost of their healthcare, they end up purchasing far more than if they had to actually pay the true cost. The result? The price of healthcare goes through the roof. Now, that being the case, premiums on health insurance skyrocket because overuse leads to very high costs. Very high average costs then gets passed on as very high premiums. But that doesn't change the fact that for each individual visit, the individual worker is still only paying $1 out of the $100 cost that he's creating. This creates serious problems for the uninsured. Without a large insured population, the high prices just wouldn't be sustainable. Nobody would be willing to pay these very, very high prices. However, with over 80% of Americans having some type of health insurance, and the grand majority of those having group insurance, it's very sustainable to have high prices, because very few people actually have to pay them, except the uninsured. The uninsured are faced with paying high prices, and don't get the benefit of trying to spread this cost to a group. So they are left in a bad situation. Now, this also explains why our outcomes, the outcomes of the American health industry, are so bad. The insured population is consuming services that really aren't worth very much. After all, they only have to pay a fraction of the cost. As long as it's worth more than that fraction, they're very willing to pay that fraction. Meanwhile, we have the uninsured that are foregoing very valuable services just because the prices are far too high for them. Prices have been driven too high by the insured, who don't have to pay them in the first place. So, what then is the root problem with American healthcare? It's not the uninsured. The uninsured are just the victims of the problem. The real problem is the system of group health insurance that leads most Americans to be totally insensitive to the cost of healthcare. This, in turn, drives costs of healthcare up. So how do we solve the problem? It's actually not that difficult. If we dismantle the system of group health insurance, it's solved. To do so, we'll take really just two major steps what need to be done. First, we need to end all special treatment for employer-provided health insurance. For example, right now, there are significant tax advantages for employers providing health insurance rather than simply paying their workers more. This should stop. Secondly, we should stop requiring a group structure for insurance. The fact is that most employers have group insurance not because it makes sense, it actually doesn't make sense, but because that is what they are allowed to do legally. They're not allowed to use a more sensible individual insurance setup. Now, a more sensible individual insurance setup, where premiums actually reflect risks, just isn't legal for most employer-provided health insurance. Now, it should also be noted that if we adopt this system, these two major reforms, we won't have to worry about people losing their insurance because they lost their job. Since insurance will be bought by individuals, individuals will keep their insurance as long as they pay their premiums. Exactly the same as my auto insurance. I keep it as long as I pay my premium. It doesn't matter if I lose my job. Given all this analysis, it should be very clear that President Obama's plan is not going to help. In fact, it's going to hurt a lot. The root problem is not that we have too little insurance. It's actually we have too much of the wrong kind of health insurance. What President Obama's plan wants to do is increase the amount of insurance that's out there and also force insurance companies that are using individual insurance plans to move toward a group insurance type of plan, which is exactly the wrong type. In short, President Obama's plan will exacerbate the root problem of expensive healthcare. It will not solve it. All we need to see that is a slightly deeper analysis of the problem than we're usually given.